Thank you. So I pretty much like history, like all kinds of history, no matter what it is. So that's why I decided to do my grand rounds on. And so it's good to have a good perspective on where things came, on how things evolved over time. And you'll see some recurring themes that we're still dealing with today that they dealt with 150 years ago. So let's start it off. So obviously, we want to talk about one of the greatest milestones would be antibiotics, obviously. Germ theory, sanitation, oral hydration therapy, tissue cultures, and vaccines. There might be other things that are also important, but just for time restraint and whatnot. We want to talk about over the last 150, 200 years, since like 1800s and forward. So obviously, let's start with, so one of the things about history that we always make one discovery or something attributed to one person, but it's always a team effort, you know? Like people think that Steve Jobs came up with the iPhone, or a smartphone for that matter, but there were smartphones before that, and he just made it better and made it much easier. Same with the electric light, you know? So there were things before that, but Edison made it last much longer, and made it more usable, and made it available for everybody. So let's talk about antibiotics, right? So obviously, penicillin is an iconic antibiotic. It was noted in 1929 at St. Mary's Hospital in London, after he observed a penicillin mold has grown and attacked certain bacteria. For about 10 years, not much was done in terms of advancement in isolating this, because chemists and bacteriologists often work separately, and they didn't have the knowledge to put everything together. However, in 1940, Howard Forley created a multidisciplinary team which led to the isolation of penicillin. So good, they isolated in 1940, but then how do you make it available for everybody else, you know? So if you have a new discovery, if it's not going to benefit everybody, then it's not really helpful. That's where Ernest Chain and Norman Heatley came in. They were part of the other multidisciplinary team, from my understanding. And they also helped isolate key techniques for isolating penicillin. In 1940s, however, Britain was getting bombed by the Germans in World War II, so they didn't really have the manufacturing capability to mass produce it. So they came to the United States, where they found the expertise and the chemical fermentation methods needed to mass produce it. So that's what they did. Penicillin was available by the time of Allied invasion of Italy. But not only did it help with war wounds and war injuries, it also helped with the syphilis epidemic that was ravaging Europe, and all across Europe, from the Axis powers to the Allied areas of Europe. So not only did it help with war injuries, it helped with syphilis. And syphilis was almost like an epidemic in Europe at that time. It's almost comparable to the HIV/AIDS epidemic in Africa. Unfortunately for the HIV, we don't have one single cure like we do for syphilis. So that's what was lacking. And there were some other posters too. I like the one in the middle. It says VD can be cured, but there's no medicine for regret. It says crossing your fingers won't prevent venereal disease. Loaded. Loose women may also be loaded with venereal disease. These are kind of chauvinistic by today's standards, but again, syphilis is coming back, you know. So yeah, I thought it was kind of hilarious. So yeah. So what are the benefits of antibiotics? So not only did it help with the syphilis and war injuries, it also made healthcare more practical for people. Now if they have a infectious illness, they could get antibiotics and get treated for it. And this led to a surge in healthcare services. In addition, it also helped advance surgery as well. Now they have one of the most complications from surgeries are infections, and then now they had antibiotics to treat it, and now surgeons can take more complex surgeries as well. So that was kind of beneficial in multiple ways. So, and now after 1960s, there was new families of antibiotics that were introduced, and subsequently, as more antibiotics are introduced and utilized more, from the mid-1990s, more resistant staphylococci and resistant pneumococci started to emerge. And now resistance is a public health issue worldwide. So where do we go from here? Basically, sequencing of bacterial genomes for huge libraries, potential targets for screening. However, now we're trying to prevent more prevention. So there's more, emphasis on the vaccines, such as for like pneumonia, to prevent, so you don't really have to treat it, so you want to prevent it. That's the goal. Now with two generations after introduction of antibiotics, there's more reluctance to use antibiotics due to development of resistance. All right. So now let's talk about the other one, is germ theory. To understand germ theory, you kind of have to understand Koch's postulates. This was back in 1880s, 1870s, where Robert Koch identified a method of identify a causative agent for a particular disease. And this is kind of based on, this may seem kind of intuitive now, but back then this was like kind of revolutionary. So basically what they did was identify a diseased animal, isolate a suspected agent, grow it, and then re-inject the suspected agent into a healthy animal and see what happens. If you can re-isolate it, then you know that a causative agent is the reason for a particular disease. And likewise, in a healthy organism, you shouldn't be able to identify it. Obviously, there are a lot of, we came pretty far from this kind of understanding, but this is where it began and helped us isolate multiple microbes and infections as a result of this. So this is where germ theory came into practice, right? In 1847, Jacob Kostelka, I can't really pronounce it, but he's an Austrian doctor. He cut his finger while doing an autopsy on a woman who had puerperal sepsis, which is like postpartum infection. A couple days later, he passed away. An autopsy showed features identical to the postpartum sepsis as a prior patient. His friend, Ignaz Semmelweis, concluded the disease that was being carried on the hands of medical providers. So basically, he insisted that medical providers should wash their hands before attending deliveries. Mortality from hand washing dropped in the medical ward from 12% to 2% in providers that washed their hands. Semmelweis then turned the theory of germ theory into clinical reality as a result of that. So then we have Joseph Lister. He's the one who kind of followed Semmelweis' work through and tried to implement the same thing in his clinical practice as well. He was aware that carbolic acid was used to treat sewage, and he kind of figured that it might be similar organisms that might be contributing to disease, and wanted to sterilize his instruments, his surgical instruments, and wash hands in the same solution as well. However, his hospital, the Glasgow Royal Infirmary, was not too keen on his techniques. At that time, they thought surgical patients' nutritional state was more important than anti-sepsis initiatives. So they initially thought it was not valid, but over time they got around to it, obviously. And it was eventually universally accepted after Koch's demonstration of infectious agents transmitted disease. So this led to an epidemiological transition as well. At the end of the 19th century, 30% of all deaths were due to infectious etiologies. By the end of the 20th century, less than 4% were. And inversely, life expectancy increased by 30 years. So where do we go from here? So again, we're still dealing with the same thing. People don't always wash their hands. So there's a pattern that's been going on for over 170 years. So and we know that this has been really effective to treat or to prevent infections in general. So we also want to improve our surveillance techniques and understanding of microbiological genetic mutation, and continue new ways to control infection as well. All right. So next one I want to talk about is oral rehydration therapy. So in the 1970s, refugees from the India-Pakistan war poured into refugee camps, which led to a cholera epidemic. The doctors often did not have enough IV saline solution or lacked the staff to administer it. And as a result, 30% of patients died within a few days. A couple years earlier, N.F. Pierce and Hirschhorn came up with oral hydration therapy, but this was only instituted in tertiary care centers by pediatric providers. So, and this doctor, Dilip Malhabis, at Johns Hopkins, developed a new oral rehydration therapy. His goal was to use it not in tertiary care hospitals, but in the refugee camps as to begin with. And over 8 weeks, the mortality rate fell to less than 1% from cholera after using of oral hydration therapy. And soon the World Health Organization implemented this worldwide as well. And in 1980s, nearly 5 million children died each year from diarrhea, and this figure by 2000 dropped to 1.8 million, which is still a lot, but hopefully it's fewer now than back in 2000, since we're 20 years from that. So this is where oral rehydration salts obviously were central to the drop in this mortality. And so at the beginning of the episode of diarrhea, the child is given increasing amounts of fluid prepared at home. And if they can't take the fluid, then you give them, or they're still dehydrated, you give them the oral rehydration solution at home or in the healthcare center. And if that's still not working, then you go to IV. So you using IV as much as, far less than you would otherwise. And I saw this, I got this picture from Amazon, and it was pretty, it's like $3 to $2. It was really cheap, so. So another thing is like vaccines are also effective against diarrheal illnesses, but however, vaccines are very expensive. In 2001, they came up with new concoctions of the oral rehydration solutions, and that were less concentrated and were shown to be better outcomes. The treatment strategy now includes zinc for a couple of weeks, as this not only reduces the severity of the episode, but also recurrence in the next 2 to 3 months as well. And I just read a report maybe like literally 20 minutes ago that's saying that zinc can also improve upper respiratory illnesses as well, shorten the course of upper respiratory illnesses. So future, where did we go from here? Now, I mean, still, as of 2000, 1.8 million people were still dying, and the goal is to reduce this even further. And this is usually in the patient populations already poor and disadvantaged to begin with. And just simple, like a couple dollars a day a couple dollars of treatment can save someone's life. So it's really effective. And I think, yeah. So the next is sanitation.
I'm having flashbacks of getting violently ill in Southeast Asia, and the only option offered to me was oral rehydration. You're puking your guts out. Not really
effective. Yeah, then you go with the IV therapy.
Not really what you're expecting. You're like,
yeah.
There's no IV. You can't. You're not gonna hook me
Yeah.
up.
So next is sanitation, right? That's another major improvement. Yeah. So in 1780s, the Industrial Revolution began. This is where people started having factories. And before if you wanted to buy something, you would kind of like have to make it yourself. If you wanted a chair, you would make it yourself. But after the Industrial Revolution, everything would be made in a factory. And this led to increase in city centers, because that's where the factories were based, you know, especially back in the day. And when people migrated from the rural areas to the cities, they were often overpopulated, and this led to unplanned urbanization. And and this led to appalling working conditions, low wages, and people got frequently sick, you know. And you can see this was like, I think, somewhere, one of the cities in England. I want to say Liverpool. I should have cited that. So infectious disease extracted a huge toll in morbidity and mortality, including TB, diphtheria, measles, smallpox, typhoid, and typhus. So back in the day, well, now we know that dysentery is caused by fecal microorganisms, but back in the day, they thought it was something called miasma theory, where they thought it was caused from decaying organic material, you know. So, and to prevent it is obviously clean sanitation and clean water were key to this. So cholera was another rapidly spreading infection, especially in Europe. Especially, there were several outbreaks in 1830, 1850, 1860s. And there was a Englishman, John Snow, who observed that near Broad Street pump, the water pump, that there are more rates of cholera. So he kind of understood that the source is probably coming from the Broad Street pump. And this is a replica of it in England, that if you go there, I think in London. But he understood that it was probably from the pump, so he stopped it. And initially, everybody kind of freaked out about it. But then, as the rates of cholera kind of came down, he became extremely famous. And this cholera not only affected the rich, but it affected the poor as well. So there was a lot of initiatives to control it. And so this led to the sanitary revolution, quote unquote. It mostly was in Britain. And one of the Englishmen was Edward Chad. So, but his idea was actually pretty good. He wants to cut the relief to the poor by preventing the cause of poverty, which back in the day was if you're the guy, you were probably the head of the family, and you were the male, you were pretty much the breadwinner, you know. So he developed legislative laws and incorporated new technology such as sewers rinsed by water and bringing piped water to individual homes. And he developed a legal framework and administrative structures to make this happen. So initially this was kind of slow, but then spread throughout the world, you know? And this had a major effect in mortality. For example, in the Netherlands, piped drinking water was initially started in Amsterdam and then followed in other cities in Holland. So by the end of the century, 40% of Dutch people had drinking water, and the early 20th century sewer system covered for more than half the population. By 1870 and 1970, standardized mortality rate in the Netherlands fell by almost 75%. There are other reasons for this, but this was one of them, you know? Obviously, you can't attribute all to just sanitation. And this also obviously decreased the risk of TB, acute respiratory illnesses, and digestive diseases as sanitation improved throughout Europe. And that's still an issue today, too. You know, I think the Bill and Melinda Gates Foundation does a lot of work in providing toilets to people in underserved neighborhoods and countries, developing countries, I guess. So in one review, global burden of disease was estimated to be 1.8 million deaths in 2001 in low and middle income countries to diarrheal diseases. Unsafe water and sanitation and hygiene accounted for 88% of these deaths. And so it's kind of important to improve sanitation worldwide so it could further decrease the amount of deaths. Then next one I want to talk about is tissue culture, which is, so basically, even back in the day, they knew that some cells were viable outside the body for very short periods of time, like such as the heart continues to beat for like a minute or two after, but it was difficult to continue that for a prolonged period of time until the second half of the 19th century. In 1930s, in Cambridge, Thomas Strangeways and Arnold Fell used tissue culture to study bone and joint diseases. And after World War II, cell suspensions included trypsin, and antibiotics were used to control contamination. This led to more viable tissue cultures. And in 1949, neuroscientists John Enders, Thomas Weller, and Frederick Robbins reported that they had grown poliovirus and cultured human embryonic skin and muscle cells. This led to them winning the Nobel Prize in 1953. And now that made it, because of the tissue culture, it made it possible to have polio vaccines, and we're pretty close to eradicating it as well, as a result of it. And you could also have the vaccine in industrial scale as a result of good tissue cultures. So not only is it tissue cultures important for infectious disease, it's also important for other areas of medicine as well. It played a crucial role in no less than 18 of the 52 Nobel Prize winning discoveries. This included RNA interference in 2006, nature of oncogenes in 89, monoclonal antibodies in 84, tumor virus in 75, and virus genetics in 1965. So obviously without cell culture, we'll lack effective vaccines against many diseases. Tissue cultures and cell cultures also allow for karyotype of patients and help us with in vitro fertilization. It also helps us grow with antibiotics for diagnostic and therapeutic purposes. Otherwise, you have to use whole animals, which wouldn't have been really effective. And tissue cultures obviously help us understand microbiology and oncology a lot better than it was before. And finally, I want to discuss about vaccines. And obviously, this is the baby about to get a vaccine, about to cry in like 10 seconds after that needle goes in. So the breakthrough with vaccines initially started with Edward Jenner with an introduction of vaccination against smallpox in 1796. He noticed that milkmaids who got cowpox did not get smallpox. So he first trialed and promoted his inoculation. He initially thought there was like a poison within it that was the preventative cure, but so he termed the inoculation vaccine as a result of it. He tried to do that, well, maybe him, but other people also tried to do the same thing with syphilis, but they didn't go too far with that, you know? So this was like a one-off event. So not much happened for about 50 to 100 years after, until we have Louis Pasteur. He's a French microbiologist who announced his rabies vaccine in 1885. So one thing about Louis Pasteur I thought was kind of interesting was that he wasn't a medical doctor, but he had this child who was bitten by rabid dogs, and he treated them in his clinic with the rabies vaccine. Initially, the French authorities were about to charge him with practicing medicine without a license, but the fact that the child survived and it was a major breakthrough, they kind of dropped the charges. So so that's why it takes, you know. So that's what it takes. But so medically untreatable diseases had been conquered by scientists and immediately looked for eradication of other diseases. So what was important about the rabies vaccine? That it was it was a laboratory attenuated live virus. Pasteur's innovation came in the fact that he, with laboratory modification of microorganisms by attenuation, which keep them less pathogenic but still immunogenic. So that was the key result of that. And as a result of Pasteur's advances, we have vaccines that save hundreds of millions of lives. And not only does it save lives, it also prevents generations from suffering from long-term consequences of infections. All right, so this is around the time that newspapers were also becoming really popular as well. So he was really good with, I guess, the media. And it was widely recognized and hailed all around France and all around the world as he became more popular. Because of his high profile, he was able to start the Pasteur Institute in Paris. And this was one of the first purpose-built medical research institutes, and it was a model for other research institutes to begin as well. So now it's kind of hard to imagine a world without vaccines. Smallpox has obviously been eradicated. And only older generations kind of remember diphtheria, whooping cough, rubella, polio, until now measles, So it's been pretty great advances. So Pasteur brought the great benefits of medical innovation to public's attention, and vaccines are considered one of the greatest, if not the greatest, medical milestone. All right, and this is kind of loosely based on an article in the British Medical Journal. This was about about in 2007. It calls about medical milestones celebrating key advances since 1840. And they kind of focused in all areas of medicine, such as anesthesia and birth control and whatnot, but I kind of focused more on the infectious disease aspect of it. And that's pretty much it. Thank you for your time.